thoughts on open glottis pushing instead of holding your breath. It's the pushing techniques one. All right, so this is your bonus question here. So there is a difference. When you are pushing, a lot of times people will describe as take a big deep breath in, hold your breath inside, and then bear down like you're pooping into your butt/your vagina. So here's my little alert to you right here. When you are pooping going forward, what I've coined this as is conscious pooping. I want you to pay attention to your pooping sensations. There is a difference, and I will get into the glottis thing in a second, but I'm totally on a rant, but bear with it, so hopefully it will help you. There is a difference between pooping out your butt and using your butt muscles versus using your vagina muscles. Like imagine pushing a tampon out. You're kind of like engaging a more like frontal muscle. Here I am doing it. You can do it with me. Versus like pushing out your butt cheeks, okay? Now, mind you, all of the muscles in the pelvis are going to help you bring the baby down. So when in doubt, especially if you have an epidural, you're using all of those muscles. But this hold your breath and then notice my face feels like it's gonna explode. I kind of have a headache almost immediately. And you can actually like pop blood vessels in your eyeballs and your face. And I always say like it's called petechiae, but it looks like your whole face like has a hickey. I've seen it multiple times. We don't wanna be pushing in your head. That's not where the baby is. We wanna be pushing in your pelvic floor, in your vagina, pushing the baby out of you, right? So one of the tricks is this idea of open glottis pushing, and you are gonna practice this now when you are consciously pooping going forward. You're welcome. So when you poop, let's pretend like you're constipated. Maybe it just falls out of you, and if it does, that's great for you, but pretend, okay, that you would take a big deep breath in, and then you would bear into releasing not only your butt muscles, but also your vagina muscles, identifying the difference between the two. And then a lot of times, imagine you're constipated, you're like, there's nothing coming out of my chest versus a big deep breath in and I'm pushing out down with the same amount of pressure in my vagina, but there's still air going through even though I can't really talk normal. That is very uncomfortable, okay? The idea is there's open or closed. Closed is, and there's this like, you can feel the pressure in your chest, in your face. That's not, first of all, it's not the most effective. And second of all, it's actually not the best case scenario for oxygen transfer to your baby when you're pushing. If you're trying to set your baby up to get the best amount of oxygen, and it's stressful, there's gonna be little interruptions here and there. And when you have a contraction, the placenta is squeezed, there's less oxygen going to the baby. They can handle it, it's like going underwater, right? But the more you do that and you're holding it in your chest, that is different. In fact, I'm lightheaded because there's so much pressure in my head than a pushing in your vagina, but there's air going through. So your partners are gonna think you're nuts going forward when you're pooping in there. Like, talk to yourself, sing a song, and I'm trying to poop myself. Please try this. This is hilarious. But it's gonna help you because if you can identify what that open glottis push feels like, whether or not you intend on an epidural. And in the United States, the majority of people get an epidural. And so there's sort of this like disconnect between your pushing muscles and doing this open glottis thing versus identifying where to push the baby. And so this is why you're practicing now. If you can, then you can apply that to when you're pushing. You have a reference point. But so often we go to teach you how to push, we meaning your nurses, go to try to teach you how to push. And it's hard to figure out where the push is. You're used to pushing with your whole face, your chest, and you're just trying to do your best. And this open glottis concept is kind of hard to get and learn in the moment, which is why you're doing it now. So the recommendation, if you can figure out how to do that and you're practicing, is to open glottis push. It's more gentle on your pelvic floor for pelvic floor injury. It's better for oxygen transfer between you and your baby. So your baby's still getting more oxygen while you're pushing. And then it's also that less like pressure and like popping blood vessels in your face as you're trying to give it your all as you're pushing. So that is my tip for you for pushing. Thank you for that question because I feel like that was a very useful and also really effective tip for you as you practice for your upcoming labor. Thanks everyone for being with me here today. If you want more, you can check out the description box down below. It has all my links to my classes, online stuff, Amazon lists, and then make sure you follow me over on Instagram at BundleBirth. Subscribe down below, and then until next time, don't forget to flex and flow, and I will see you soon. Bye.